The Hondius outbreak is settled. The case counting's over. We're looking at the empty shelf that stays empty after the ship sails. This is Hantavirus Watch. Today, a new UNMC review, a diagnostic trap that looks a lot like the flu, and the first survivor voice we've had all week.
And the question that sticks around after the outbreak, when's a summer cold actually a get-to-the-clinic moment? Sarah, start with Nebraska.
Prasantha Dash, writing in University of Nebraska Medical Center Newsroom.
The Andes virus, ANDV, these passengers may have been exposed to, is the exception to hantaviruses, in that it has shown limited person-to-person transmission. During outbreaks involving Andes virus, additional public health measures such as isolation and contact tracing may be required for close contacts due to the potential for limited human-to-human transmission, Dr. Dash wrote.
New today, UNMC has a review from Prasantha Dash in Pharmacology and Experimental Neuroscience, published in Neuroimmune Pharmacology and Therapeutics. It's a broad overview: epidemiology, pathogenesis, clinical features, transmission, and therapeutic strategies. The useful piece here is that Dash names the Andes strain directly, the hantavirus exception, with limited person-to-person transmission. And he says isolation and contact tracing may be warranted for close contacts for that reason. It's the same strain tied to the Hondius passengers UNMC monitored for 6 weeks.
So that's 2 independent research teams in basically one news cycle ending up in the same therapeutic strategies section. And the honest read hasn't changed. The shelf's still not exactly full.
I'd call that the shift. Monitoring is closed. Now we're looking at research and the treatment gap. I don't know yet whether a pharmacology and neuroscience framing adds much beyond the clinical reviews we've already seen. From SciTechDaily.
Hantavirus is a nationally notifiable disease in Canada, meaning every confirmed case must be reported to public health authorities. Canada records about 4 to 5 confirmed cases each year, most of which are linked to exposure to rodents in agricultural areas of Manitoba, Saskatchewan, Alberta, and British Columbia. One strain, known as the Andes virus, is unusual because it can spread from person to person.
Okay, I've actually been chasing this one all week. When does a Maine summer cold turn into a go-to-a-clinician now moment? SciTechDaily finally names the early warning signs. That's the piece I wanted.
2 CMAJ articles here, one on Ebola and one on hantavirus, and they land on the diagnostic problem. Early symptoms can overlap with influenza. That's real. But I'd separate the strains before anyone panics. Sin nombre goes pulmonary, fever, muscle aches, then a fast respiratory crash. Andes can do that too, and it's the one with documented person-to-person spread. Sol leans renal, same flu-looking opening, 3 different back halves.
And Canada sees 4 to 5 confirmed cases a year, mostly tied to rodents in prairie farm country. So for a Hondius passenger still in their window, don't stop at fever. Watch for the fever that suddenly gets much worse. That's the line.
BBC World Service with Lindsay Brown.
Lorne Warburton had never heard of the hantavirus until 3 years ago when he was taken to hospital and put on life support, describing the sickness as torture and hell on earth. The Canadian told BBC Outside Source that in March 2023 he started feeling unwell with COVID-type symptoms, body aches, a chronic headache, and fatigue.
We've got a named patient account here. Lorne Warburton, Canadian, from BBC Outside Source, published May 7. He caught hantavirus 3 years back in March 2023 and ended up on life support for 3 weeks. His account gives us something case counts can't, the clinical timeline from the inside. COVID-type body aches, then he couldn't breathe. We don't get the strain or the transmission route. We do get a very clear picture of how fast this can escalate to a ventilator.
And that's the part that lands, Sarah. We keep saying fluids and oxygen, no targeted treatment. Warburton shows what fluids and oxygen look like from the mattress. Body aches to life support, drenched in sweat, couldn't breathe. Pair it with that SciTechDaily piece we just hit. Starts like the flu. That's the whole trap. Warburton had never heard of hantavirus. Neither has your average person feeling lousy in July.
I'd hold the line there, Brian. An account this vivid is exactly the kind of thing that gets shoved into pandemic framing. It shouldn't be. One survivor's experience doesn't make an epidemiology. The monitoring arc is closed. His story gives us the clinical picture behind the numbers, nothing more.
Fair. One man, 3 weeks, and he walked out. But between him and the UNMC review, we've got 2 research teams and a survivor, all pointing at the same empty shelf this week. If you're a listener, what do you actually do with that?
You watch for the escalation early, and you get to a clinician. That's the value of an account like his. He didn't know what it was until he was already on the machine.
If Hantavirus Watch helps you stay informed, take a second to subscribe and leave a review wherever you're listening. It really helps other people find the show and keep up with the latest. You'll find links to every story we covered today in the show notes, so if something caught your ear, you can dig in there. That's Hantavirus Watch for today. This is a Lantern podcast.